Hey, this is Dr. Mark Richard, orthopedic surgeon at Duke University, and I hope that everyone is safe and healthy. Today on Diamond Doc, we're going to talk about thumb injuries. But let's first talk about the uniqueness of the thumb. It is positioned on the hand to provide what is called prehensile grasp. What that means is that the thumb can serve as a post to pinch against the fingers and provide the ability to do very fine, detailed work. Or it can wrap around an object like a baseball bat and provide stability for strong grip. It is a very human anatomical feature, and it is critical to the tasks and functions that we do every day. If you have ever injured your thumb and not been able to use it, you realize how much we take it for granted in daily life. So what are the most common thumb injuries in baseball? I think most of us remember Mike Trout's thumb injury in the 2017 season. This injury was very representative of the most common ligament injury to the thumb. The ligament is called the ulnar collateral ligament, like the elbow, and it is located on the web space side of the thumb where the thumb meets the hand. How does this injury happen? Like Mike Trout, it most commonly occurs with a head-first slide when the thumb gets caught and forcefully pulled away from the rest of the hand. This results in the concentration of forces at the ulnar collateral ligament and can lead to injury. If the injury causes some of the fibers to tear but some remain intact, the player can be treated in a cast, and the injury is expected to heal over 6 to 8 weeks. If the entire ligament tears off of the bone, surgical repair may be necessary in order to restore stability to the base of the thumb. In acute, complete injuries where the ligament is completely torn off the bone, the surgeon reattaches the ligament with an anchor in the bone and sutures, pulling the ligament back to its attachment. The results of this surgery for MLB players have been evaluated by Dr. Jack and colleagues. They found that all players were able to return to sport and, on average, were able to play at the same level as previous. For players who were in season at the time of their injury, they missed an average of 8 weeks. Comparison of their performance pre and post-injury showed no significant differences, unlike what we see with ulnar collateral ligament injuries of the elbow after Tommy John surgery. Newer techniques use a bit of suture tape to augment the repair, which may help to decrease the recovery time. A recent review of competitive athletes with ulnar collateral ligament injuries of the thumb treated by this technique showed that in-season athletes returned to play at a mean of 5 weeks. Keep in mind, this was a variety of different sports. Mike Trout had this procedure and missed 6 weeks or 39 games. Drew Brees sustained the same injury to his thumb in week 2 of the 2019 season and was able to return week 8. In the end, the ulnar collateral ligament of the thumb is a critical ligament for normal thumb function. If injured severely enough to require surgical repair, players are able to return at the same level of play as they had before the injury. Awareness of the risks for injury, like a head-first slide, and use of protective equipment to avoid catching the thumb can also mitigate the incidence of injury. Do you have other questions or comments about thumb injuries in youth baseball? Please respond in the comments and ask your questions using the hashtag USAB mailbag.